So this slide talks about the project plan and desired outcome and conclusion. So my focus population is my middle school by using the health belief model, and this is how I'm able to incorporate it into my in my school setting. At my middle school, I have 3 diabetics. I have noticed that they're not informed about the diagnosis, how to count the carbs, knowing the symptoms of high and low, and when to administer insulin. They're also not aware of they're able to do exercises. They're displaying symptoms. One of my students newly diagnosed, and the other 2 is diagnosed last school year. They're not knowledgeable of the regimen that is displayed on the doctor's order. As the nurse of the school, I will go through the order with the student, explain what symptoms are high or low, what is diabetes, and how to count carbs. I will create a PowerPoint describing this main points to the staff members that will be also involved with the child, like teachers, counselors, principal, so they can be aware of their care of the child, encourage them that they can do activities of physical education. Teens or middle school students will require a different approach, such as health belief model, that will motivate, educate, and create self-management with their diagnosis. According to the study that was done in Dominican Republic, utilizing the health belief model to aid the change of perception of adolescents and understanding their new diagnosis of type 1 diabetes, and is able to influence their self-management of the diagnosis. And that's why I want to incorporate it to the health belief model in order to have and visualize self-efficacy, that they're able to self-management of their diagnosis. I will talk to the principal to discuss the importance of being knowledgeable of the disease process of type 1 diabetes, and she can spread the word to the teachers by emailing or giving a notification through their mailbox. As a school nurse, I will work hand to hand with the principal and have our supervisor contact area operation, is a department that oversees academic safety, and the health office. Area operation could come and see our pilot program implementing the health belief model with our diabetic students and evaluate how our program has a positive outcome and improve our diabetic students' self-efficacy with this diagnosis. Once they have seen the great progress done, then they will introduce it to the superintendent to implement it throughout the schools. This pilot program will take place at the start of school year and evaluate by the month. That will be time frame. Evaluate the beginning of the school year, and then go throughout the school year, and before the end of the school year, we'll evaluate the outcome of the students. In order to evaluate the students' progress, it is implement of the pilot program work on the students. We will conduct a pre and post assessment survey using a scale from 0 to 5 on how confident they're able to perform tasks of their diabetic treatments, having 0 to be the least likely, and 5 being the most likely they're able to management their treatments by the diabetic. By the end of the school year, we will see that implementation of the health belief model with type 1 diabetes students would help them gain the confidence of being able to share their diagnosis with their peers and be able to self-care of their own diagnosis without aid of the trained staff. Conclusion, hopefully the staff and the students that are diagnosed can be verbalized, understand what is type 1 diabetes and what kind of interventions can be used to prevent being high or low.